The biggest queue lined up for us, of course, is the union budget. In a matter of less than 10 days, we'll get to know what's on the mind of Finance Minister. But ahead of that, we have been speaking with a whole host of experts, right from the corporates as well as the experts. And we have Suchi Raid, partner at Deloitte India, joining us, as well as Mohan Nisetti from Lupin to talk to us about what their expectations are.
So for the Indian headquartered companies, it is important that there are certain R&D incentives which should be there in the tax. One most important one, which was already there in the Act, was the weighted deduction of R&D. And the second is expanding the patent box regime, which is there for the global sales of the R&D or the products that they develop using their own R&D. Now, these two aspects will automatically increase and foster their efforts towards the R&D in India. But there are fine prints which are yet to come, and it is important that this particular aspect of this sector, which is research and development, that's given due weightage and recognition in this budget. The second one which I will pick up is on the production and manufacturing side. India has always been considered as a good manufacturing location, but I think it is important that now we make it a demand location. Now, how can really it happen? I think it's if I look at it backward working, it's having more and more hospital infrastructure and expanding the medical education. These two things will automatically take care of the demand creation and consequent supply. But this particular facility, and there is a remote access of the facilities, but at the same time, it becomes lucrative for the companies to invest in the sector.
From a healthcare and life science industry's perspective, I have three key recommendations or expectations from the Finance Budget 2025. The first one is in terms of increased healthcare spending. To achieve the country's Viksit Bharat aspirations by 2047, it is important that we have a much more healthier and a more productive population. It is expected that the budget would move up the needle in terms of spending on healthcare from the present 1.9% of GDP to at least 2.5% of GDP. This would in turn translate to better infrastructure and improved access to quality healthcare, particularly in underserved areas. The second expectation is in terms of incentivizing innovation and R&D. India has a marked advantage in terms of having a strong intellectual pool of resources who contribute significantly in pharmaceutical R&D processes. However, the R&D process itself is very long and very expensive. So extending additional tax deductions for R&D expenditure would go a long way in achieving the aspiration of reaching a $130 billion market by 2030. By providing additional tax deductions for R&D, the government would actually encourage companies to innovate, to invest in new and innovative solutions, which would in turn drive growth and competitiveness in the industry. Also, additional tax deduction should be considered for training and skill development, ensuring that the workforce is equipped with the necessary skills to support the industry's growth. The third expectation is in terms of incentivizing domestic manufacturing. The production-linked incentive or the PLI scheme for pharmaceutical products has successfully boosted manufacturing and enhanced export competitiveness. However, the scheme should be made more flexible to cover a larger skew of products, which would in turn drive economic growth and create more job opportunities.